currently undergoing treatment for cervical cancer, and that from the notes and from Dr. Capon that you're tolerating it very well. And so just to kind of go over things, so you got a PET scan that looks like back in January, and then it showed that the cervical cancer had come back, and then you were started pretty right away with chemotherapy. But on that scan, they showed the little area in your breast, which ultimately led to you getting a mammogram and a biopsy, and then found out that, lo and behold, this is a separate cancer. Yeah, okay. But you're not having any nipple discharge? Have you noticed any nipple discharge, skin retraction, or anything like that? No, you can't feel it yourself. Okay, all right. Is there any family history that you're aware of breast cancer, ovarian cancer? Do you have children?
Yes, I got 2 girls.
2 daughters? Okay, how old are they?
23
25 and 23.
25 and...
Why are you looking at me? They're not my kids.
All right, very good. And any medical problems besides the cervical cancer? You're otherwise healthy? Okay, and then she was telling me the only surgery you've had is a tubal ligation?
Yes.
Okay, and you have an aunt that had cervical cancer?
Yes.
Okay, all right, no allergies to medicines. And you smoke a pack and a half a day?
Yes.
And how long have you been doing that?
30 years.
About 30 years, okay. All right, I'm not going to beat you. Okay. All right. Okay, so let me just examine you, okay?
Just in case the door opens, I never know.
Okay. And let me examine the left side first, the side that
Sister-in-law.
Sister-in-law.
I just washed my hands, so they're a little bit chilly. And how often do you receive your treatments?
Every 3 weeks.
And the mammogram that you just had, when was the one prior to that? Did you have one prior to that?
It has been actually 10 years since I've had one.
Oh, 10 years, okay. All right. Let's have it. Okay. Okay. So, I did speak with Dr. Capon, okay, about what's going on with the cervical cancer. And even though you have the breast cancer, the cervical cancer right now is, of the two, is the most important, okay, the treatment for that, because it's the most serious, it's more serious than the breast cancer, okay? And so we want to treat whatever is the most concerning first, and you're already started on the chemotherapy. So we wouldn't be able to do a surgery on the breast while you're getting chemotherapy. One, because you may not heal from the surgery, because the chemotherapy, of course, doesn't just kill the cancer, it sometimes kills good cells too. So sometimes we need those cells to help with healing. So we wouldn't be able to do chemotherapy and surgery at the same time. And right now, the chemotherapy is extremely important to try to treat, to get rid of the cervical cancer, okay?
I already know that I can't get rid of it,
Right.
so I won't be stopping the chemo, so I didn't want.
Well, the chemotherapy may have some effect on the cancer, the breast cancer. And also, the breast cancer, because it's very small, it's probably been there for quite some time, it's very slow growing. So of the two, it's not going to cause a problem before the cervical cancer will cause a problem. If we were to do your surgery, one, you may not heal, and two, the surgery, if you have a problem with the surgery and you don't heal, it will stop your chemotherapy.
Okay,
And then that's a real problem.
okay.
Okay, so it would be a different situation if your tumor was really big in the breast, and sometimes people come in and they've got pus coming out and stuff like that, and then we're like, okay, we definitely have to take care of it. We cannot wait, we can't delay anything. But let's say that you get the chemotherapy and, things shrink down and you get a PET scan and Dr. Capen is like, wow, you're having a really good response, this, that, and other. Then we may have to say, okay, well, let's revisit this breast cancer situation. Okay, but to put you through an operation, even a small one or a large one with mastectomies and things like that, would not be in your best interest. It potentially could shorten your lifespan as opposed to extending it. So we're always weighing the risk and the benefits. And then when somebody has another problem, like a cervical cancer, we're like, well, which one is going to be more important right now? And right now, cervical cancer is really much more important than the breast cancer. Even though I know it's scary to have that diagnosis in your head, but that is not going to cause you a problem. Okay? And I'm always going to be here, so and Dr. Cape and I are going to be working together, so he will get in touch with me if he feels that there are any issues that are arising from this, or he may say, that patient, she's doing really great. I think we need to have you see her again, and then I'd be glad to do that, and then we may take you to surgery and take care of that. It may be even smaller. I mean, I can't even feel it, it's very small. Okay? But I am going to present you a tumor board, your case. Okay? The tumor board consists of social workers, nurses, the radiologist who did your biopsy, the pathologist, surgeons like myself, medical radiation doctors, the whole team of us are there. And we're going to look at your x-rays and we're going to look at your case and make sure that everybody's in agreement with that.
Okay.
And they don't have any other things that they would recommend that would benefit you. So we like to present patients at tumor board because it gives lots of perspectives and other opinions so that we're not missing anything and we can offer you everything possible. Okay, any questions? I know she said you had a list of questions.
One question I do have is, how often do we need to recheck this?
Well, Dr. Capen will be doing CT scans and PET scans and scan her from head to toe, and now that we know it's there, he'll be able to, what they do at different intervals, when she's getting the chemotherapy, they'll be scanning her to see how effective the therapy is, and then they'll be able to look at the disease that's measurable right now, and they can see if it's getting smaller,
Right.
or if it's stable, and they'll be able to check. So he'll be the one that will be monitoring that. In terms of mammograms, we don't need to do another mammogram like anytime soon.
So it doesn't need to go to 6 months?
No.
Okay.
We know it's there. He's going to be doing scans that will be able to compare, because that's how it was picked up in the first place with the PET scan, so he'll be doing more of that. And then also he'll be examining her and everything, and you can examine yourself as well. So if you feel that there's something changing, the skin is indenting, if there's anything draining from the nipple, anything like that, pain, then we can, then you can always, you don't have to even go to Dr. Capen, you can just say, hey, I need to see Dr. Doway. I want her to check this out, even if it's something you're not sure about. That's what I'm here for, okay? To give reassurance and then we can always go back and revisit that.
Okay.
Okay?
Think of anything else?
I think we pretty much covered it earlier.
She did a good job covering it.
She did.
All right. So right now we're going to do the tumor board, and then if there's anything different than what I'm recommending or that we're going to add, then we'll get in touch with you. okay?
And when
The
will
two
y'all
of us
have
are-
that review and,
Every Tuesday we do it, so she'll be on for next Tuesday,
okay.
yeah.
And will we know anything from that? I mean, will we, I guess, is there any way to get online to see the notes from,
There's not. The way that usually happens is, I guess really you would only hear if there was a change in the plan as she has presented it to
Okay.
you.
Yeah, because then we would call you back in and say, okay, this is what,
okay,
yeah, if we were gonna operate, or if I knew for sure I was gonna be doing something, then we would have you follow up, and then we would, then we would present the options that we thought were
okay,
reasonable options. So if there is anything different, or if there's anything different that they want to tell Dr. Capon, then he would follow up with you on that. We don't wanna inundate you with, I don't wanna have you come back in and say, no, there's no change.
Well, I just didn't
Yeah.
know if maybe there was, if y'all
Yeah,
did anything
Usually we-
online
yeah.
versus where we could,
That's a
where
good
I could go
idea,
in and
though.
read.
yeah, do they have that here?
They
I know
don't,
just
but that's a good idea.
Yeah,
Yeah.
yeah, some hospitals now, it's like the future where patients can go online and they can check their labs and they can check certain things, and then they can email the doctor and communicate that way without having to always come back in and check certain things. So that might be the future here too. Maybe one day, get more, even more high tech. But, yeah, we're definitely gonna discuss it, and if there's any changes, we will definitely get back in touch with you.
Otherwise, you just keep on keeping on with your plan with Dr. Capon.
Keep doing a good job in chemo.
Hope so.
Well, it looks like you're doing good, you're tolerating it, so.
Yeah, it's pretty good. Yeah. It bothers my leg, but really being sick, I'm not really that sick a lot. Tired after a while, It's it's going pretty easy.
Good.
A lot better than radiation. The radiation last year
That
was really
rings
bad.
directly to my desk, just another number that if y'all ever need anything, you can reach me.
Okay.
I work with breast cancer patients, and I can help you with anything, appointments, or just questions.
Okay, sounds great.
The other thing, that, may be of benefit, not so much directly to you, would be your daughters. And when we do present them at tumor board, there is a geneticist that's there. And so sometimes we can test people for, their predisposition or their chances of possibly getting a cancer. Sometimes there's certain genes and things that run within a family that can predispose us to developing cancer. So we'll be discussing that as well to see if your daughters may need to be, well, besides their routine screenings, they are getting pap smears, I hope, with their, seeing a gynecologist and getting pap smears to screen them for cervical cancer, of course, but for breast cancer as well. There's a couple genes that we have identified, and